Patrick McGorry, Professor of Youth Mental Health at the University of Melbourne and Executive Director of Orygen, the National Centre for Excellence in Youth Mental Health. I work with young people. I'm a clinician, I'm a researcher, and I guess I'm an advocate as well for reform in mental health care for young people. Well, we began probably 25, 30 years ago focusing on young people in the first stages of a psychotic illness. And we very quickly realised there were two issues. One was to actually identify and detect the illness at the earliest possible point so that the damage can be limited and the person can resume like a normal life. And the second thing is we had to get a lot better at having evidence-based treatments to help them recover fully and actually do no harm in the process. I guess what we've found is it's possible on an evidence base to identify these illnesses at an early stage, and we're extending this beyond psychosis into a whole range of disorders, and produce better outcomes in the early years of illness. And it's very important because this is a critical time of life that people are establishing their identity, their relationships, their careers, and if they don't get better quickly, then all of that is under threat. So we've learned that it's possible to actually change the trajectories and produce much better outcomes as long as there's investment in youth mental health care with an early intervention focus. I think it'd be really good if every parent, every politician, every health bureaucrat and every media operator understood that it's not just a matter of doing the right thing from an altruistic point of view for the young people on the threshold of adult life, but it's a very self-interested thing to do because it's your kids, it's your family that's going to be at risk, because 50% of young people will experience a period of poor mental health in the transition to adulthood. And at the moment we have very weak and poorly based systems of care to engage them and to help them and their families deal with the threat. An English psychiatrist once said, the neglect of adolescent mental health is a form of self-harm inflicted that society inflicts on itself. So it starts a lot earlier than what you're saying, and the consequences are that there's tremendous wastage of human potential for a whole bunch of young people, emerging adults, who never really make it. They die of suicide, or they become disabled and on welfare, or they underachieve. They don't realise their potential. So that's starting to get through to the policymakers. Just purely the economic argument is starting to bite, but also the voters are being mobilised in support of better services for young people, and politicians are starting to respond to that. We've got to radically change the culture of care so that we have an engaging, welcoming culture, a nice facility to go to, which isn't stigmatised, doesn't have a mental health sign out the front, is much more about youth engagement, but also has the expertise, the evidence-based expertise, and I don't just mean drug therapies, I mean psychological expertise and broader forms of social therapy as well, to help the person recover fully, not just in a symptomatic sense. So it needs a very radical change, and we're starting to see that in many countries with youth-friendly primary care services like Headspace in Australia. We're seeing the early psychosis services being built and funded across most developed countries, including the US now, finally, a belated thing in the US. Well, I suppose everyone thinks we need breakthroughs, and the big hope in psychiatry has always been the neuroscience revolution, that we're going to somehow understand the brain, in the near future well enough to develop novel therapies and so on. And obviously we've got to keep doing that, but we can transform outcomes for young people already if we actually invested in what we already know works, and in delivery systems that engage young people so they can access it. So there's no reason why the vast majority of young people with mental illness cannot have happy and fulfilling lives, even with the present state of knowledge.